we are going to discuss about the sign and symptom of abnormal electrolyte values. And also we are going to focus about the nursing intervention. So in this picture or in this page, you can get all electrolyte together. So the reason being, I put everything in one page so that you can compare and contrast when you study them. So like the first one, potassium, second sodium, third calcium, and fourth is magnesium. The normal potassium level 3.5 to 5 milliequivalent per liter is the normal range. So optimum range is 3.5 to 5. But if the potassium is less than 3.5, you called hypokalemia. If potassium level is more than 5, we call hypercalcemia. Everybody know that, right? So before to go the main discussion about hypokalemia or hyperkalemia, first of all, we have to know what are the function of potassium in the body, or what are the function of sodium in the body. So the main function of potassium maintain intracellular fluid, maintain the stable, steady condition of intracellular fluid, means the fluid inside the cell. ICF stand for intracellular fluid balance. So another major function of potassium, nerve function, nervous system, and also regulate the muscle and heart contraction. So if you compare about the sodium, the major function of sodium maintain the fluid balance. Same major function of potassium, maintain fluid balance, especially intracellular fluid. Second function, nerve function. You see, sodium also important role to normal nervous function or muscle function, but potassium particularly helped in the cardiac muscle contraction. You see the calcium. Everybody know calcium is the important component of your bones and denture or teeth. But as like as potassium and sodium, calcium also important role in nervous system and muscle function. Something you have to add, the calcium is an important component of clot formation. Like bleeding occur. When bleeding, we need to stop the bleeding. We need to make the clot. Calcium help you. What about the magnesium? As like all of potassium, sodium, and calcium, magnesium also work nervous function and muscle function. So you can see I put red color. So this is a common function for every electrolyte. As like calcium, magnesium also important component of bone formation. What else? Magnesium is the important for critical for many biochemical reaction. Biochemical means chemical reaction in living tissue. Chemical reaction when occur? During metabolism. By the chemical reaction, energy produced called ATP. And now going to focus when imbalance occur, what are the sign and symptom? So like potassium when less than normal range or 3.5, which is called hypokalemia. And when potassium is less than more than 5, we said hyperkalemia. So what are the cause of potassium, cause of hypokalemia? What are the cause? Loss of potassium. Major cause is the GI losses, gastrointestinal loss, means vomiting or gastric suction or diarrhea, right? Or diuretics. So if you take some diuretics, some Lasix, furosemide, too much urine passing means fluid loss and hypokalemia develop. Or skin loss, right? Or if anybody have a metabolic alkalosis, they develop hypokalemia. When vomiting occur, metabolic alkalosis occur. When diarrhea occur, metabolic acidosis occur. So like the hyponatremia, the also common cause are GI losses, diuretics, skin losses, right? It's same. But some are extra. This is called SIADH. It is endocrine disorder, basically, right? So edema, hyperglycemia, and heart failure can cause hyponatremia. But get back in the hypokalemia first. So if you study different book, some books said heavy perspiration means fluid loss, basically, or use of potassium wasting diuretics, potassium wasting, because some of the diuretics basically losses the potassium, or like poor intake of potassium, right? Or like when poor intake. Common problem is anorexia nervosa or alcoholic client, right? So if your patient have a hypokalemia, what are the common sign and symptom? Common sign symptom are dysarrhythmias, means heartbeat not normal, hypotension, when fluid loss, blood volume loss. When blood volume loss, blood pressure go down, and it is called hypotension. And you know that potassium is an important component of muscle function, nervous function. So muscle weakness, weak pulses, and patient develop cramping or constipation develop, right? So this is a common sign and symptom if patient have hypokalemia. If you go in other book, some books said something more, but whatever more, it is, I want to say it is a common problem, weakness. Weakness means fatigue, lethargy, anorexia, or nausea, vomiting, or decrease the bowel sound, decrease the bowel mobilities. When bowel mobilities reduce, patient develop constipation. And hypokalemia also can causes decrease the deep tendon reflex. Decrease deep tendon reflex. But hypomagnesemia increase deep tendon reflex. It is called DTR, increase, but hypokalemia decrease the deep tendon reflexes. Also, one more information we have to know about hypokalemia, like if you check ABG gas analysis, ABG stands for arterial blood gas analysis. Arterial blood gas analysis may show alkalosis, or even if you go in EKG, we can see the T wave flat, ST segment depressed, or prominent U wave. So if you ask me, what are the nursing intervention? What are the nursing intervention? Because when we work in a massage unit or floor, we has to deal the patient. But if we do not know how to care my patient, right, then there no reason I will be there. So it is very simple, and I want to tell you, almost for all electrolyte imbalance nursing management, principle is same. Principle is same. It is called nursing care. So in case of hypokalemia, we has to monitor the heart rate and rhythm, because patient develop dysrhythmias. I want to tell you, hyperkalemia and hypokalemia, both cases develop dysrhythmias. So both case nursing management, we has to monitor the heart rate and rhythm. Then we has to monitor the client any receive, client receive any kind of digoxin or not. We has to closely monitor it, because hypokalemia increase the risk of digitalis toxicity or digoxin toxicity. NCLEX board frequently asks this question. If my patient have a hypokalemia, I has to check my patient take any kind of heart medication like digoxin or digitalis. If they take it, we has to tell to healthcare provider, because hypokalemia condition causes increase the risk of digital toxicity. If we see my patient has a hypokalemia, you give oral potassium as prescribed, or give them potassium with food or with fluid to prevent the gastric irritation. Or sometimes we administer IV diluted potassium, right? Now question come, what are the causes of hyperkalemia? Hyperkalemia means for when potassium level more than 5 milliequivalent per liter. The main cause, uncontrolled diabetes. So uncontrolled diabetes means DKA, diabetic ketoacidosis, or metabolic acidosis. What about the hyperkalemia? Metabolic alkalosis. Here is the metabolic acidosis, right? Salt substitute, kidney fail, and spironolactone. Spironolactone means potassium sparing diuretics. Potassium sparing, who can catch up the potassium, right? So one of the most important cause of hyperkalemia are renal failure patient, or if my patient take potassium sparing diuretics like spironolactone, or if my patient take high potassium containing food too much, or excessive use of salt substitute, they develop hyperkalemia. So if my patient develop hyperkalemia, what are the common signs, symptoms they developed? They develop dysarrhythmia like hypokalemia, muscle weakness, also hypokalemia patient develop muscle weakness. And in same hyponatremia, patient develop muscle weakness, tingling, abnormal sensation, diarrhea, confusion. So diarrhea, confusion, irritability is very common, right? Some books said in case of hyperkalemia, patient develop paresthesia and numbness in extremities. Numbness means abnormal sensation or tingling sensation, same as hypokalemia, same sign symptom. And now question come, what about the EKG? In hypokalemia, the T wave is flat and ST segment depressed, but in in hyperkalemia, they develop the peaked T wave and also widening QRS complex. So now question come, what are the care if my patient develop hyperkalemia, right? What are the care of my patient hyperkalemia? Care, limit the food contain high potassium, also admin loop diuretics, so potassium loss and it will be correct. give them sodium polystyrene or sulfonate or insulin. What else? What others management? Basically, we are RN or LPN. Our measure function closely monitor the cardiac status because patient develop dysrhythmias, or admin diuretics or other medication such as glucose or insulin as prescribed. Also, we have to hold the potassium supplement and potassium sparing diuretics. Monitor the serum potassium level very carefully, right? And also teach your client to avoid the food rich in potassium and salt substitute. Now go back in another one is called the sodium. Already we discussed the function of the sodium. We are going to focus about hyponatremia and hypernatremia, these two. So what are the normal sodium level? It is 135 to 145 milliequivalent per liter, right? 135 to 145 milliequivalent per liter. So if the sodium is less than 135, we can say hyponatremia. If the sodium is more than 145, we can say hypernatremia. So just give a focus here. Hyponatremia. What are the causes of hyponatremia? Like as hypokalemia, GI or gastrointestinal losses. Gastrointestinal loss means diarrhea, vomiting, or excessive sweating. It is called the skin losses. Or hyperglycemia, heart failure. Like you give your patient diuretics and patient is too much pee, definitely electrolyte loss and call hyponatremia. Diuretics cause hypokalemia, hyponatremia. So what are the symptoms, sign and symptom? Like patient develop tachycardia, means increase the heart rate, or hypotension. In hypokalemia, also hypotension, because fluid loss, blood volume loss, blood pressure loss, and hypotension. And confusion, lethargy, confusion, anxiety, all are central nervous system problem. Confusion is most common in elderly patient. What about the GI problem? Patient develop abdominal cramping, anorexia, nausea and vomiting, right? And for nausea, B for vomiting, headache, fatigue, common symptom. So question come, if my patient have a hyponatremia, what are the nursing intervention? Again, I said, we are nurses. Our responsibility is to take care of my patient. So closely monitoring the vital sign. And also see the or assessment, the sign and symptom. What sign and symptom? Like hypotension, tachycardia, confusion, muscle twitching, seizure, coma, everything we have to monitor. If anything, we should notify healthcare provider. And if patient have a hyponatremia, we should monitor the intake and output or monitor the lab values. Also, we have to assessment the client closely for injury risks. We have to prevent the fall. Also, encouraging the food or fluid high in sodium. Also, limit the water intake as indicate. What next? Next are hypernatremia. So if the sodium level is more than 145 milliequivalent per liter, and we said patient develop hypernatremia. So the common cause of hypernatremia are water deprivation or excess sodium intake, kidney failure, or diabetes insipidus. So if anybody undergo the burn, the fluid loss, water deprivation, fluid loss, excessive sweating, fluid loss. When fluid loss, solute is increased in the body, and sodium is a solute, right? So loss of the fluid is important cause of hypernatremia. Some books said insensible water loss or diarrhea, water deprivation, or excessive salt intake also cause hypernatremia. Like IV intravenous administration of saline solution or excessive use of table salt, diabetes insipidus, shortly called DI. DI stand for diabetes insipidus, or heat stroke also causes. Other most common cause are Cushing syndrome. It is the endocrine disorder, right? So what are the sign and symptom if your patient have hypernatremia? Patient develop tachycardia, muscle twitching, weakness, GI upset and edema. So muscle twitching, weakness, also hyperkalemia, muscle weakness, numbness. Also hypermagnesiumia, muscle weakness, right? So now question come. If said, I ask you, what are the central nervous system change place? I mean, symptom in hypernatremia. Patient develop fatigue, restlessness, decrease the level of consciousness, disorientation, and convulsion. All are very severe hypernatremia sign and symptom. Attack the brain. Question come, if my patient have a hypernatremia, what is nursing intervention? Same like other, closely monitoring the patient, vital sign monitoring, monitor the intake and output chart, monitor the mental status, because very severe condition, brain attack, means decrease the level of consciousness, disorientation, confusion develop. And also monitoring the lab result, encouraging fluid intake as prescribed, also restrict the intake of salt and food high in sodium, restricted to intake. What else? Next one is hypokalemia and hypocalcemia and hypercalcemia. So question, what is the normal range of calcium? It is 9 to 10.5. Some books said 8.5 to 10.5. Calcium. So I remember California, 8.5 to 10.5. California. So it's calcium, 9 to 10.5. But some book more wrote 8.5 to 10.5. So if calcium less than 8.5, we say hypocalcemia. If calcium more than 10.5, hypercalcemia. So calcium is below normal. What are the reason calcium is go low? So like you know the thyroid gland secret T3 T4, but beside of thyroid gland there are two more glands called parathyroid gland. Parathyroid gland has an important role of maintain the equilibrium of calcium and phosphorus. If unfortunately remove the parathyroid gland during the surgery of thyroid disease, and patient develop hypocalcemia because parathyroid gland secrete calcium. So surgically remove of parathyroid gland, and this when surgically remove parathyroid gland, it is called hypoparathyroidism. Hypoparathyroidism, right? Other conditions such as acute pancreatitis, you see the pancreatitis, or like hyperphosphatemia or thyroid cancer, or if inadequate vitamin D intake or vitamin D deficiency can cause hypocalcemia. Some patients have a history of malabsorption or malabsorption, or if your patient has a hypomagnesemia. The patient who have hypomagnesemia, they have also hypocalcemia. Or if your patient has a sepsis or alcohol abuse, they develop hypokalemia. Frequently asking the question in NCLEX board from hypokalemia. So what are the symptom or sign of hypokalemia? The major sign, positive chopstick sign and also positive trouser sign. This is the two sign. If positive, it is indicate patient has a hypokalemia. If patient has a tetany or tetani, or right, also sign of hypokalemia: muscle spasm, numbness, tingling, GI upset, and hypotension are the sign and symptom of hypokalemia, hypocalcemia. So let me recap it for you. I said if patient develop the numbness or tingling of the extremities or tingling sensation around the lips or mouth, or muscle tremor, cramping, or if patient develop the tetany or cardiac dysrhythmia or positive chopstick sign or positive crossword sign or confusion, all of them indicate my patient have a low calcium level. Keep in mind, if your patient has a low calcium, they must be suffer with hyperphosphatemia also. So when body reduce calcium, in the same time phosphorus level go up. So now question, what are the nursing intervention? Okay, so nursing intervention means we closely monitor respiratory and cardiovascular status, closely monitor, and also initiate the safety precursor to protect a confused client, because hypocalcemia causes confusion. Admin the oral or parental calcium supplement as prescribed, and also during intravenous administration of calcium, we have to closely monitor the cardiac status of the patient, or we should closely monitor EKG. What next? Hypercalcemia. Hypercalcemia. So we know when calcium level more than 10.5 milligram per dl, we said hypercalcemia. So the most common cause of hypercalcemia, calcium is an important component of bones and teeth formation. But when excess calcium, bones are broken. So fractured bone is a common complication of hypercalcemia. Go back, what are the common cause of hypercalcemia? Common cause is if anybody have a hyperparathyroidism, because parathyroid gland secrete calcium. If patient have a hyperparathyroidism, they have excess calcium in the body. If anybody is prolonged immobilization, or if any malignancy of the bones, patient develop the hypercalcemia. Long-term steroid use, bone cancer causes hypercalcemia. So the symptom, if patient have hypercalcemia, common symptom, if anybody have a hypercalcemia, constipation, or decrease the deep tendon reflex, decrease the deep tendon reflex, right? So decrease the deep tendon reflex, but hypomagnesemia Hypomagnesemia increase the deep tendon reflex. When magnesium go down, deep tendon reflex increase. When calcium go up, decrease the deep tendon reflex. If you compare and contrast, it would be easy for you to remember. So if your patient develop the kidney stone, if your patient have a hyperkalemia, they have a chance to develop the kidney stone. What else? What other sign? Patients sometimes complain of lethargy or weakness, anorexia, nausea, vomiting, GI problem, right? And I said renal stone. It is the kidney stone. But sometimes patients develop polyuria, hypercalciuria means calcium present in urine, or flank pain secondary to the urinary calculi means urinary stone. Now question come, what are the nursing intervention? So if my patient have hypercalcemia, we should increase the client movement and exercise because immobilization can cause hyperkalemia. So encouraging for movement or courage for exercise, courage for oral fluid is permitted to maintain the dilute the urine. Also teach the client to limit the intake of food and fluid high in calcium. Increase the fiber in diet to prevent the constipation. So fiber containing food. Protect a confused client and monitor for pathological fracture, because when calcium is too high, risks of fracture bone in increase. So we have to protect them to fall. Courage to intake of acid ash food like purine or cranberry juice, encouraging to take, right? The last one here, it is magnesium. So what are the normal range of magnesium? 1.3 to 2.1. So if the magnesium level is less than 1.3, we said hypomagnesemia. When magnesium is more than 2.1, hypermagnesemia. So hypomagnesemia, the most common cause, GI losses, right? Excessive fluid loss is a way. Excessive fluid loss from gastrointestinal tract like vomiting, diarrhea, or nasogastric suction, fistula drainage, or long-term use of certain drugs like diuretics or aminoglycoside antibiotics also cause hypomagnesemia. Malnutrition, alcohol abuse, important cause to develop hypomagnesemia. So what are the symptoms and signs if your patient have hypomagnesemia? Patient easily develop dysarrhythmias, tachycardias, hypertension, tremor, and seizure. So neuromuscular irritabilities with a tremor or a seizure. So if your patient develop the seizure, seizure precursor is the first priorities. Increase the reflexes. What reflex? Deep tendon reflex. Increase. Convulsion. Convulsion means involuntary movement of muscle. Cardiac arrhythmias or dysarrhythmias. Patient develop tetany or psychosis. Something is interesting. The patient who have hypokalemia, they have a positive chopstick sign, positive trousseau sign, positive tetany. Same patient who have hypomagnesemia, they have positive chopstick sign, positive trousseau sign, and positive tetany. Tetany means involuntary movement of muscle, convulsion. So if your patient have a hypocalcemia, what are the nursing intervention? First of all, we have to assessment the client receiving any cardiac medication like digitalis or digoxin. Why? Because of digitalis toxicity or digoxin toxicity. Because hypomagnesemia increase the risks of digoxin toxicity. What are the other electrolyte causes digoxin toxicity? Hypokalemia. So when potassium go, when magnesium go, or hypokalemia or hypomagnesemia, both increase the risk of digoxin toxicity. So if my patient take the digitalis or digoxin, we have to inform healthcare provider to protect the toxicity and protect the patient for injuries or protect your patient from seizure precursor. Also, we should check EKG. What else? Hypermagnesemia. So hypermagnesemia, when the magnesium level is more than 2.1 milliequivalent per liter, we called hypermagnesemia. The most common condition causes the hypermagnesemia are renal impairment or kidney diseases, or if the patient have an uncontrolled diabetic mellitus or DKA, or if your patient has a dehydration or laxative containing magnesium. Sometimes we give magnesium for constipation, and magnesium increase and causes hypermagnesemia. If patient have a hypothyroidism I said, patient develop hypermagnesemia. If your patient has a Addison disease, patient chance of develop hypermagnesemia. Or simply if your patient take antacid too much, they chance of develop hypermagnesemia. So next, what are the sign and symptom if my patient have a hypermagnesemia? Like patient develop hypotension, muscle weakness is like a hypernatremia, hyperkalemia, muscle weakness, same color, muscle weakness, lethargy, respiratory or cardiac arrest, and patient die basically because this problem, cardiac arrest and respiratory arrest. So let me add something. Sometimes hypermagnesiumia patient develop neuromuscular depression or arrhythmias. Because of arrhythmia or cardiac muscle depression, they develop cardiac arrest. Or sometimes central nervous system depressed or lethargy or develop hypotension or bradycardias. This bradycardia also causes the cardiac arrest. So now question, what are the nursing intervention? So our intervention initiate the safety precursor first for my patient. Monitoring vital sign, especially blood pressure, because hypotension is a problem. Or monitor the pulses, respiratory rate. Why? Because respiratory arrest. Admin the calcium gluconate. If your patient has a hypermagnesiumia, give them calcium gluconate as prescribed, because calcium gluconate interact with magnesium and formation magnesium gluconate. And also teach the patient with renal disorder, because underlying cause of renal disease is called hypermagnesiumia. So when we reinforce or educate the patient with renal disorder, they can avoid preparation containing or magnesium. So this is the very important note we should read for NCLEX board exam.